Okay, let's continue with the integumentary system. We'll now look at the dermis. So before we just covered the epidermis, right? Up here is epidermis. Epidermis. Now we'll look next at the dermis down here. So the dermis has two layers to it, two regions. There's the top region here, this top portion of the dermis is called the papillary layer. Papillary layer. This bottom portion is called the reticular layer of the dermis. Okay. So the top layer, the papillary layer, is basically areolar CT. The reticular layer is dense, irregular CT. That's the kind of tissue that you find in these layers. So in the papillary layer, these parts that go up, these upward projections, okay, we call these your dermal papilla. Dermal papilla or papillae. And they contain blood vessels and sensory receptors inside there. Okay, and they also help to interlock the epidermis and the dermis. In fact, these parts that come down, these downward pointing parts of the epidermis, these are called the epidermal ridges. So the epidermal ridges lock with the dermal papilla, like so, to interlock both regions of the skin. Also here in the reticular layer, which has dense irregular CT, here you have, this is where you find the hair follicles. Hair follicles are down here, blood vessels are down here, sweat glands, sebaceous glands, all packed into the reticular layer of the dermis. Fibers present here. So some dermal fibers, dermis fibers. Again, you're going to have collagen fibers will be there, which give it its strength. Won't pull apart. In fact, the dense irregular is made up of your collagen fibers. And then you also have elastic fibers there to give the skin its resiliency, its bounce backness to it. Okay. Some things that can go wrong here. Sometimes you get stretch marks. Okay, stretch marks appear in the skin when you tear the fibers. So that's caused from ripped or torn collagen fibers. Okay. Wrinkles happen when the fat content, the bouncy content of the dermis is lost. So here, this happens when the dermis starts to sag. As it sags, the epidermis also sags, and you see the valley in the skin or the wrinkle in the skin. So it's called a dermal sag. The dermis is losing its elasticity, and so the skin wrinkles in that region there. You also have things called tension lines. Tension lines, can't really see them, but they're there. It's even though this is dense irregular CT, there is an overall pattern to the collagen fibers in the way they run. And so those create lines through the skin where if you were to cut the skin, you want to cut in such a way that they're parallel to these tension lines. So it's almost like collagen orientation. Collagen fiber orientation. And these lines tell you how the skin is being pulled along those collagen fiber lines. Okay. Then we go to the hypodermis. The hypodermis is the bottommost region here. Again, here is filled with fat cells, adipocytes. Okay. hypodermis. So what about the hypodermis? So the hypodermis, okay. Here we call it the subcutaneous fat. It covers the body, tends to be distributed different in genders. You know, it's in females. It's a lot in the breast, the buttocks, okay, perhaps even thighs. In males, get in our neck fat, also in our belly, in our bare belly, okay. So the fat is everywhere, frankly, but it tends to, in terms of gender, go certain spots more so than others, okay. What's next? Let's look next then at some of the accessory organs that come from the epidermis, or the integument in general, okay? So we'll begin with the nails. So the nails are basically scale-like corneocytes. These are your keratinocytes. Your stratum corneum of the skin becomes hardened to give you the hardened, scaly nails. So the nails, this is your nail here, like so, and like so. Here's your skin. So the part of the nail that you can see, the top part here, this is called the nail plate. Nail plate. Right here where the nail meets the skin is your nail fold. Back here beneath the skin, you can't really see it. This part here where the nail grows from is the nail matrix. That's where the nail grows from out. And beneath the plate sits the nail bed. So nail plate sits on the nail bed. So if you were to rip up your nail like this, beneath it would be in fact, the pink stuff you see is your nail bed beneath your nail. And most nails have a little part right here, a white part, okay, called the lunula or lunule. It's white because the tissue beneath there is thick enough so it hides the blood vessels, so you can't see the pinkness anymore, okay? So it's just thickened epidermis there to prevent you from seeing the blood vessels of the dermis, form your lunule. Okay, that's it for nail. Let's go to hair. All right, so this is your hair. This is your skin. You have hair follicles. All right, hair follicles. That's where hair grows from. So the hair is like this, coming up. Okay. So it's your hair strand called pilus. Hair strand is called pilus. And the part above the skin, this part around here, we call that the shaft. That's the part that you shampoo, right? And then down here is the hair root. The part is below the skin. This structure around here is called a hair follicle, by the way. Hair follicle. Hair grows in hair follicles. So for hair, you have different types of hair. So types of hair. You have the hair that you have on the body before birth. So before birth, that hair is called lanugo hair. Unpigmented is like a peach fuzz over the skin. At birth, most of this hair is replaced by vellus hair, thin hair that covers the skin. And then even at birth, you have what's called terminal hair. Terminal hair comes along at puberty to replace vellus hair, but even at birth, hair, so we call it after puberty, darker, you can see it. But also there, your scalp hair, scalp and eyebrows, and eyelashes are always terminal hair. Okay, even at birth. So three forms of hair there. Latigo, vellus, and terminal hair. Okay. Let's look some more at this hair follicle stuff here. So here's a hair follicle. And this is the walls of the hair follicle. Hair follicle here, we have an outer CT, what's called root sheath, and an inner ET root sheath. So inner ET, outer CT. There is this expansion, this inner kind of inner expansion here of the hair bulb of the hair follicle is called the hair bulb. So here, this part here is hair bulb. And in the bulb, you have this part. So this part is basically, this is the hair bulb right here. Hair bulb, not to this part. So then this part of the hair bulb is called the hair matrix. Matrix. That's where the hair grows from. So here's the hair matrix, and as they undergo mitosis, they push the hair strand up. And then this part here is the hair papilla. Okay. It's like a kind of white in microscope preparations. The papilla has blood vessels there. So it brings food here to nourish these cells. So they're alive, they can multiply to grow the hair strand out from beneath the skin. Hair growth. Hair growth. So again, hair grows from hair follicles here. And so the hair follicles may be active, say for maybe 6 to 10 years straight, especially on the scalp. For your eyebrows, it may go just 5 months and then stop. Then rest for about, let me make sure there's scalp stuff here. Rest for about 3 to 4 months. And then start again. And once it starts again, the old hair strand will fall out. And you get a new strand coming up. So for 10 years, you have one follicle growing, maybe at an inch or so a week. As long as it's fast. It's kind of fast, I'm not sure. Somewhere close in the inches zone, it goes per week. And then after a while, it stops for 3-4 months. Then you start new hair growth, and the long strand, what long it is, falls out, and you have a new hair strand is growing there. Okay. Yeah, sometimes you have hair loss, alopecia. So as you get older, in your teens, your hair grows the fastest. Teens to your mid-30s, very fast growth. After a while, you lose hair faster than you grow hair. So when hair loss is greater than hair replacement, then you have what's called hair thinning, alopecia. Happens in both genders. In males, it happens very quick, very early in life, and females a little bit later. Okay. And in fact, when females lose alopecia, when you get this alopecia, then the terminal hair is replaced by vellus hair. Males have what's called male pattern baldness. Right. This happens because testosterone, called DHT, dihydrotestosterone, it stunts the growth phase in hair follicles. And so the follicle cannot grow long enough for the hair strand to show up above the skin. So it stays down in the skin in the hair follicle because the growth phase is shortened. Instead of being long for 6 years, maybe on for a couple months, and hair or even weeks, even hair will not come above the skin by then. Okay, we're almost done. Well, let's take a pause. I don't want this to be too long.